Tong here with my co-host.
Wilhelm. Welcome back, and definitely there's going to be so much information shared here. You may want to keep your pencil and pens and paper and highlighters handy.
Absolutely. There's so much we can do that I think for people who are searching, they know. But I just want to mention that we actually treat a lot of people with high blood pressure with acupuncture. So if you're ever interested in that, check us out in our website, which is www.azmdlaser.com. That's azmdlaser.com.
And a phone number to set an appointment?
The phone number would be 480-598-9733. It's 480-598-9733. So we encounter this question sometimes on the people who still have hope. Is high blood pressure or hypertension curable?
Right.
Most people are told by their doctors, no, it's not a curable disease. You are going to live with it the rest of your life. You need to take your medication the rest of your life.
Wow.
Which is not always true. I think there's a good point the doctors are saying that because they want to make sure you're taking your medicine. So you actually control your blood pressure, because the only way to avoid the bad consequences of those end organ damages is to control the blood pressure day to day. So that was good to make you be alert and be always on the guard for your blood pressure.
Mm-hmm. And also in their defense, it's kind of like when you're young but old enough to get married, and then you talk to your parents about it, and they say, you know what, she is who she is. So she's not going to change. Now, is it possible for her to change? Sure. but they're just making that statement so that you take a reality check.
Exactly.
And I think that there was a similar thing going on
well,
there.
First of all, we've talked about the blood pressures fluctuate with your different mood, activities, and how could it be constant? I mean, it's not constant. So it is an ever-changing number. And why would it be fixed at a high level forever? Don't you think there's a chance that you can cure it?
Yeah, to me, there is definitely a chance through exercise, nutrition, getting because, I mean, I guess you're talking to a guy who was 90 pounds heavier at one point, and so, theoretically, maybe I had 3 or 4 miles of extra capillaries back then for my heart to push through, and I don't think I even took my blood pressure back then. I don't know what I had, but I do know that it's good now, and so there are certain limitations, though. Sometimes you may have damaged your body to the point where it's not going to completely heal, but
That's
it can
correct.
at least countermeasures.
I want to put it this way. Now, if your uptightness or a personality that's usually more stressed, or your lifestyle doesn't change, yes, your blood pressure problem is going to stay right there forever. Then you're not, it's not curable.
Right.
But if you change all the factors that contribute to your high blood pressure, even though they're not like a tumor or anything that you can cut out, but if you can actually modify your lifestyle enough, you may have enough change that your high blood pressure can get down. So how is high blood pressure treated? Usually is either in the conventional medicine, is either with medications or lifestyle change, or both. So if you're borderline, the numbers are not really that high, but on the alert, you could start doing your lifestyle changes, and hopefully never get to the criteria that you're diagnosed for sure to be hypertension. So guess what kind of lifestyle changes we need to make to reduce the blood pressure? Guess a few.
Some tough ones. Definitely the way we eat. Maybe or maybe not. Depending. It's controversial about salt intake, but and then also your exercise levels. Definitely.
Yeah, very good too. Salt intake is actually pretty proven. In the old time, not that old, when we're talking about letting out blood from leeches and inducing fever to reduce blood pressure, complete, no intake of sodium was one of them.
I see.
in the historical history of treating high blood pressure in
Oh,
the early
interesting.
time. Oh yeah, it's hard not to take any salt at all.
Yeah.
But definitely low salt intake will help with blood pressure control.
Mhm.
Exercise, for some reason, when you are constricting, relaxing your muscles and at the same time your blood vessel walls are more flexible. That by definition will reduce your high blood pressure, right?
Right.
Because if you have more flexible blood pressure walls, then yeah, you're gonna have the lower or more normal blood pressure.
Mhm. And I mean, if you think about salt, if you put salt in anything, it holds more water and it expands. And so, yeah, I can definitely see where the
Absolutely.
salt impacts your body.
And to control the salt, you not only not to add any table salt to your, not too much of it,
Mhm.
to your food. You also need to watch out the food you buy itself.
It, I actually love salt, but I never put salt on anything because I don't need to because it's always there. That's how bad it is, even though I
Exactly.
love salt.
And well, in our next show, we're going to continue on a lot more remedies, home remedies, and alternative things, and herbal treatments. But today we're going to focus a little bit more on these.
Sure.
The salt is also in canned food, processed food. There's so much of it that you're right. You don't need to add anything to it. But if you're trying to go with a low salt diet, you may want not eat too much or any processed food, canned food.
If I could throw something out there, just I know you're going to probably talk about it next show, but I found that lemon tastes salty when you put it inside of things. In other words, it simulates that feeling of zest.
I don't know about that.
Yeah, I do.
How could you say lemon is salty?
Well,
It's sour.
Well, because that's only when it's a hint. So in other words, say in your salad dressings. So when I put lemon inside of the salad dressings that I make, it actually has a salty
Well, actually,
feel to it.
technically, a lot of those vegetable or fruits are very high in potassium, but they do have a little bit sodium in it.
Oh, maybe that's why, because it actually has some sodium.
Yeah.
All right.
It's
Well,
a low
here
amount
I
though, but
stand.
much more of potassium.
Gotcha.
And another thing I can't help to mention is actually yesterday I went with two of my best friends.
Mhm.
One of them is doing the juicing
Oh yeah,
only diet.
yeah. We talked a lot about juicing
Yes,
previously.
and
Mhm.
she was having some craving for salt,
Ah.
and I told her to try ginger.
Yeah, ginger is good in that
She added ginger
juicing.
to that her diet, and
To
she's
quit the
like,
craving?
she doesn't crave for salt anymore.
Yeah, it's
So
a
that's
very
another
fresh,
little tip.
clean flavor as well as that kind of salty. Yeah, I can
Right.
actually relate to what you're saying.
So with the traditional medications, there's something called beta blockers.
Mhm.
That's one class of medication. Something called calcium channel blockers. There is something called ACE inhibitor, and diuretics, which
Okay.
helps you to make more urine, lose more liquid.
Uh-huh.
And also something called alpha blockers. And also there are some direct vasodilators in the peripheral vessels. Those are the common drugs in treating hypertension.
I see.
One interesting point I want to mention is that calcium channel blocker is actually has been reported to be related to cancer.
Oh, really? It
I didn't
creates
know that
cancer
until
potentially?
I read about it. I'm like, wow. So they basically found out in the postmenopausal females who have been taking calcium channel blocker for over 10 years
Mhm.
would have 2.5 times higher chance of getting breast cancer compared with
Wow.
the counterparts who either don't take any blood pressure medication or has other blood pressure medication.
Wow.
So that brings to a point that medications do have side effects. So if you can go modify your lifestyle, change your diet, exercise, quit smoking, limited alcohol,
Mhm.
all these things, and it's obviously better.
Sure.
Another thing that's really, really helpful to reduce blood pressure, other than limiting sodium, is increase the potassium, magnesium.
Oh, really?
Yes.
All right, so lemons are back in for a different reason.
Oh yeah, oh yeah. That's that's one thing about why our current scientific studies are not perfect.
Mhm.
There's so much we don't know in medicine or life.
Right.
Admitted it or not. We know lemon's good for you, but we're not exactly sure the 10 different things in lemon, which one that's lack of, or it has, benefits you, or all of them, or
Right.
all of above. So when we're doing a study, we're only picking one factor. We're trying to blind other things out. So that was good intention, to kind of isolate one thing out. But is isolating one thing out the only way or the best way to go?
Because life is holistic. Our bodies are holistic.
Exactly,
Yes.
exactly. So actually, sometimes the whole herb or whole vegetable or fruit works better than that one ingredient.
Mhm.
There's some examples on that. I think we covered one of them. That's anti-malarial, that herbal medicine.
Oh yeah. Mm-hmm.
When you extract that one chemical out, the bacteria develops the resistant to it much faster. But if you use the whole herb, then it works well for a long time without the resistance.
Interesting.
Interesting, huh?
Yeah.
So a lot of times we think pure is better, more refined is
Mhm.
better, and now it's time to think back. Is it true? Maybe it's back. We should go back to less refined,
Mhm.
more holistic, more whole. Whole grain is another one.
Yeah, that would make
better
sense
than
too.
the refined. Now we know that one.
Correct.
Yeah.
We actually were reading an article about that. So I guess we're going to go straight through, or do we want to take a short break, or what's the best thing for us?
I think that was an earlier one.
Oh, was it?
It
Oh,
wasn't
okay.
this one, yeah.
Okay.
Because that's 340, 42. Not right now, it's 52.
Okay, so I guess we'll go straight through to the end
Yes.
of the show.
So,
You know what? While we deviated, I have to ask just a off-the-wall question.
Sure.
Does blood pressure have anything to do with spider veins or varicose veins?
not directly or not so much.
Okay.
Because those veins are usually venous, on the venous side, not arterial.
Oh, I see.
Because when we're talking about blood pressure, we're talking about arterial blood pressure,
Mhm.
which is the part that comes out of the heart.
Mhm.
The part brings the used blood back to the heart is the venous part.
I
And
see.
that's more superficial. That's where the spider veins usually come from.
When it's coming back to the heart?
Those are venous, and they usually have
see.
very low pressure.
I see.
Not like blood pressure is over 100, it's very low.
I see.
So,
Okay, good to know.
So, other things that help with reducing the treatment, how is blood pressure treated, high blood pressure treated, is beetroot, what we use for juicing a lot.
Mm-hmm.
And it's believed that that's the nitrates in it that helps reduce blood pressure. I don't know about it. It could be the vitamin C.
It's the sugar.
It
The
could.
sugar helps.
There are so many things. We know the beet helps. Do we have to extract it and make it into a capsule? Do we have to?
No.
Or can we just juice?
Yeah, just juice. Even I believe in that.
So other things that are high in nitrates that we believe that in the literature that believes that can help with the blood pressure is cabbage, lettuce, radish, carrots. All these wonderful things, we know they're good for us.
Mhm.
They help with the blood pressure too.
Right.
Another thing I want to kind of focus on a little bit more that is really, really proven. We don't know the theory exactly, but we know it's proven that it helps with the blood pressure, is yoga.
Yoga really works really well for that.
Yes.
Okay.
We talked about blood pressure is affected by nerve system, either central nervous or sympathetic nerve systems. So yoga really comes first of all from the mind. Relax your head. Have you ever tried yoga?
I have. Now, I love yoga, but there's two problems. And I know this is TMI again, but two problems I have. Balance. And since I've been young, I have a hard time stretching. So I'm not good at it, but I enjoy it.
Well, you're too hard on yourself. Yoga is something you do without competing with other people. There's no yoga competition.
Well, I need to have just a personal yoga instructor because it's hard to think. I'm not competing with anybody, but I sure look funny.
Right. But you compete with yourself. So as long as you're moving along a little bit at a time, do it to this degree where you can feel it, you're doing something. So I think the way I look at it, yoga has a couple of different components. One is mind relaxation. You put your mind down. You only focus on breathing and your body. Your body posture, your body being stretched. So the mind part is a big one. The breathing is the second part. Breathing is actually very good in relaxation and also delivering oxygen and also energy, qi, to different parts of the body. The third part would be the body stretching. So I think we're going to conclude today. We're going to actually continue about this topic in our next show. We're going to talk about all these healthy tips and natural remedies that can be applied in helping with hypertension. One last thing on the stretching part is we're exercising not only the muscle, also the blood vessel too. So.
Right. That's great to know. I'm even more excited to exercise than before. So also, if you want to find out more information, go to azmdlaser.com, set that appointment, and let's leave with the phone number.
It is 480-598-9733. And we give consultations on those natural remedies too. So.
Thanks again for tuning in to Ageless Living here on World Talk Radio on Voice America. And we'll see you all next week.
All right. See you next